Hi everyone, my name is Ashley. I'm doing my oral medication pass-off. So I'm going to start here in the med room where I'm going to go ahead and gather all of my supplies. I'm going to go ahead and do some hand hygiene, and I'm pulling up the EMR and I'm going to check the medication order, compare it to any past orders, and look for any allergies. Alright, so I see that they need Lipitor, so we're going to go ahead and unlock the med cabinet and get the med out, and I'm going to do my first check. So we've got atorvastatin. We're looking at it here, matching it for my patient. So it looks like Jonah is getting this medication for cholesterol. So we're gonna go ahead, and I don't see that he has any allergies. He's had this in the past, so there's any contraindications, no issues with that. We're gonna go ahead and look over his 6 rights. So we have Jonah, and we have the right medication, so the right patient, the right medication. It's an oral dose. Looks like he's used to that, and it looks like it's within the right time frame. He's getting it for the right reason, to lower his cholesterol. So we have the patient, the medication, the dose. We're within the 30-minute time frame of giving his med, the right reason for cholesterol, and the right route, oral. So now that we've confirmed his 6 rights, we're going to go ahead and just think about any nursing considerations. So I'll go over the use of alcohol with this medication, also liver checks. We'll be monitoring that. It doesn't look like he needs an assessment or any vitals done before this medication. So now that I've compiled everything I need to know about him, I'm going to go ahead and get this med over to his room, and we're going to actually dish it up in his room, so that, because I have to scan it in his room. So we're gonna go ahead and just take everything we need over there, and we're gonna make sure we do one patient at a time. So I'm gonna go to Jonah's room specifically, and before I go into the room, I'm gonna knock. Hi, this is Ashley. I'm your nurse for today. Can you just verify your name? Thank you, Jonah. And what is your date of birth? Perfect. And then I'm going to go ahead and verify that on his armband. I'm going to do some hand hygiene again now that I'm in his room. And I'm checking it. Thank you. That looks great. So I've got the medication here for your cholesterol today. It looks like you've been taking it. Do you have any allergies with this med? No allergies, and you tolerate it well. You don't have any side effects? Okay. Well, it looks like we're within the time frame of giving you this medication. Some side effects you could experience are nausea or a headache, but you've never had any issues with those? Okay, perfect. So we'll just watch for that. I'm going to do my second check of the med. So we've got Lipitor. The dose is correct. It's within the safe dose range. So now I'm going to go ahead and dish up this medication and get it ready to administer. So with the medication, we want to put it in the lid. We don't want to just like reach in and grab it. Just with a pill, that's just how we administer it. If it were a multi-unit dose package, we would bring that package directly to the room before administering. And if it were a liquid, we would go ahead and look at it on eye level. So we've got it ready to give, but before we can, we've got to do our 3rd check with the patient. So we're going to go ahead and just scan his wristband here. Perfect, and it did verify that this medication is for Jonah. And just verify the scan on here. Scanning the barcode for the medication. Perfect. So the patient and the medication have all been verified. That was my 3rd check. I've gone over the 6 rights, and we don't need to do an assessment before receiving this. So we're going to go ahead and we verified the patient, the drug, the dose, the route, and it is the correct time. I'm not going to mark yet that he's taken it. I need to actually see him do that. So we're going to go ahead now and have him take this medication. And here's some water for you, and you're okay swallowing pills? Good. Okay. So he swallowed. Did that go down okay? Perfect, okay, and I witnessed that he swallowed the medication. So now it is okay for me to go ahead and document that he took his medication. What I'll do now is just go over some things with Jonah. So Jonah, it looks like we're going to want to follow up with you in about 30 minutes to an hour just to make sure that you're not having any side effects or anything. So we'll go ahead and document that you took your meds today, and then we'll follow back up with you in just a little while, okay? So then I'm going to go ahead and go out and knock, knock, knock. Hi Jonah, how are you doing? Good, I'm glad to hear it. Any side effects going on or anything? No? Perfect. So we would have our tech redo some vitals just to make sure everything was going good. We'd review those, and then also the liver labs when they come back as well. But his EMR has been documented that he took his medication and he doesn't have any side effects, so he should be good.